Mr. Monti, please unmute your
can't hear
microphone.
you.
My apologies. I thought I was unmuted. So once again, good afternoon and good morning and good evening to all of those of you who are connected from other time zones. And warm welcome to this panel session around overcoming cultural barriers through respect and dialogue. My name is Roberto Monti, and I have the great pleasure to co-chair this session together with Ms. Edelgard Bohlmann, former federal minister and former deputy vice president of the German Bundestag. And we of course want to start off, give a very warm welcome, a special welcome to our panel guests that we will introduce more thoroughly in just a short while before their respective initial statements. But still, we are all here, connected in remote, but visible on the screen. So we have with us today Professor Clara Cruz Santos, Professor of Social Work at Coimbra University. And we have Dr. Justin Vez, Director General at the Paris Peace Forum. And we have with us Ms. Nera Tandem, that I don't see on screen right now, but should appear, but she's online. So Ms. Nera Tandem, that is CEO and President at the Center for American Progress. And then we will also have Professor Dr. Tola Oni, who's Medical Research Officer at the University of Cambridge, that will join us during the session. So, well, everyone, very warm welcome and thanks again for joining us. This is a very exceptional year, and of course, it's become exceptional also for the World Health Summit that had to adapt to the ongoing pandemic. So if this is normally a summit taking place in Berlin physically, it first turned into a hybrid event and then later migrating into an entirely digital event. But the good thing with this, besides saving us a lot of CO2 emissions, is that we also by definition become a bit more open summit, allowing for even broader participation. I do hope that we have a lot of listeners, and I already take the opportunity to ask all you listeners to interact with us during the Q&A session and share your questions. Now, before listening to our speakers, we would just like to give you some short background around the Respect and Dialogue Initiative as such, but of course, more important so, some information and introduction around the workshop in particular. The Respect and Dialogue Initiative springs from the InterAcademy Partnership, which is InterAcademy Partnership gathering national science academies around the world. And their wish to have science contributing even more to a better world by lifting the potential that sits with respecting others' views and the power that sits in dialogue and interaction. And since many global crises are born or grow deeper due to sometimes the lack of comprehension or lack of interest, or even sometimes lack of courage to reach out across borders, and I would add maybe borders of very different nature. Then also solutions very often don't come alive, since simply we don't get the right key stakeholders together around the problems or around the possibilities to solve them. The United Nations 17 Sustainable Development Goals, they give a very good and ambitious framework to the world, an inspiring one, but they also need steady and tangible movement and progress. So the InterAcademy Partnership therefore decided to declare a joint interest in how to approach and how to be able to contribute even more to the realization of these goals, and thus also then giving birth to this Respect and Dialogue Initiative, which then should lead to, let's see, an open, enlightened cultural discussion atmosphere, and of course trying also to lead some tangible movements. The mission is to promote better understanding among people, cultures, and of course enhance and promote and enhancing the interaction between various stakeholders. And to do so by addressing the sustainable development goals in a holistic way, but starting off and using health as an entry point, thus being also highly relevant for a summit like this. The Sustainable Development Goal number 3, that reads to ensure healthy lives and promote well-being for all at all ages, is of course crucial in itself. but very much also true that it's connected to other development areas for a more sustainable world. So the initiative invites to join forces to create new partnerships and join action between academies, emblematic places, religious or cultural, political, educational networks, or any other key relevant stakeholders that might be interested to join. Now, key will of course be to identify the real priorities and to remove the obstacles. Engaging the diversity of opinions, engaging people across borders and stakeholders in order to create preconditions and conditions for positive change. We had a very interesting workshop or panel session already in the last World Health Summit in last year, where we discussed possible ways to proceed and also taking examples that we can learn from. But it was more in the wider sense. In this year's panel, we would like to be more specific. And for kind of obvious reasons, we would like to examine respect and dialogue in relation to the ongoing pandemic. Not so much from a strictly medical point of view, considering that the World Health Summit offers plenty of space for that focus during many other parts of the summit. And now, in order to have a common ground and a joint understanding of this workshop, I would like to just very briefly give the background and approach we wanted to take. So in the response to the ongoing pandemic, we claim that we have witnessed instances of dialogue and respect for each other's perspectives, but also at times, and very often, noticeable and important lack thereof. So in this year's session, we wanted to look at these instances and see in what way we could learn from and take lessons from what we have experienced. And to do so, and be able to actually approach the continuous efforts to handle the pandemic and other global challenges. The COVID-19 challenges have clearly exposed needs of various nature, underlining also the strong interdependencies between good health and other sustainable development goals, but also dramatically unveiling the importance of multilateralism and multi-perspectivity. We believe there is a substantial progress to be found through active listening and interest to learn from knowledge and opinions across sectors, disciplines, and cultures, and by that creating better preconditions for how to tackle these common and global challenges going forward. And we will be doing so by listening now first to our panel, which consists of experts and leaders from various organizations and sectors. And we have addressed some key questions for them. And then we will continue with the discussion during the Q&A session. But now I will be handing over to my co-chair, Edelgard, that will elaborate around these key questions and introduce our first speakers. Please, Edelgard.
Thank you very much, Roberto. I also would like to welcome all of you for a hopefully very interesting workshop. And I hope, and I'm sure many people share this hope, that we will not only talk about the negative experiences we have made over the last couple of weeks and months, but might also move to the chances and get some new ideas how we can improve our cooperation, not only in the medical field, where it works quite well, but also in the other fields where we can improve our cooperation, also coordination of our efforts in different countries to overcome these barriers we have between still countries, but also between cultures and even between social groups within our societies. So I'm hopefully for very good, lively, interesting discussions with many good new ideas. And as we have very interesting panelists, I'm sure that this hope will not be in vain. So our expectations are very high. And we will have some time also for a discussion with the audience. So I ask you very much to stick to the time which we talked about. That means 8 minutes for the panelists. Then we will have a short discussion between the panelists, and then we will open up the discussion for the audience. And I would like to encourage also the audience to participate in the discussion, although I know that this is not very easy in this format, but we have to do our best, and we will all try to do our best. So just let me line out the key questions which we presented to the panelists, also to include the audience and let them know what is expected. So we asked the panelists to talk to us about their experiences from the COVID-19 pandemic and their experience, as I said, not only in the way the countries, the governments, the cities, the communities dealt with the pandemic, but also how it improved collaboration, where it didn't work, where it worked, and what are the reasons for either, for working or not working. A second question we presented to our panelists is what is their view on the relation between political approach in different countries, different regions, and people's lives through this pandemic. Is there acceptance? What are the reasons for acceptance? Is there, well, a very big skeptical group? What is this relation between what is decided by the governments and what is received by the people, and how do they react? And how can the underlying thought of this workshop, that respect and dialogue is crucial for a good cooperation and coordination within a society and country, but also across national borders, how can respect and dialogue promote this interaction between different groups, between different countries, between different fields within a society? And the last key question, well, not the last, but the third key question was that we thought, let me say it differently, we thought that, and we think that throughout our history, we can observe that governments in crisis tend to restrict and close borders, national borders, but they also tend to erect borders, sometimes even within a country. And we can observe that in some countries. In others, not so much, but in some countries, yes. And so what are your reflections on that? And what are your reflections on what can we do in order to break down these borders? Because we have to do it in order to fight the pandemic successfully. We have to break down these borders. And so what can we do? What should we do? And what are effective instruments, effective approaches to break down these borders? And our last point was that in spite of the weaknesses of today's multilateralism, what role would you give to global platforms? We have the WHO, which plays an important role, which is a global platform, but we have not only WHO, we have the G20 platform, for example, as a global platform. We have, for example, also regional platforms like ASEAN, I mentioned, European Union, of course. We have other regional platforms. So what could be their role, and how could we improve their effectiveness? What can be done to improve their effectiveness in such a crisis as a pandemic? And if you could also point and give some outlook on that from your experience, it would, I think, also be very helpful. So these are the key questions, but now we are all curious and very interested in hearing from your point of view, what you think about these aspects I mentioned. And I would like to introduce the first speaker, which is Neera Tandon. She is, as Roberto already said, the president of the Center for American Progress, a think tank which, Neera, I hope you share this view, at least from my point of view, is not only a very progressive think tank, but a think tank which really promotes knowledge-based policy and fights against social inequality, which I think in our world is crucial. So you have been working on this think tank for quite a long time. Before you became the president of the think tank, you worked in several areas as a director in the think tank. But you not only work in this think tank, but you promoted at Yale Law School. You work in different other positions as a big campaigner for American presence, like Barack Obama in 2008. But you also worked also in the general election campaign for Hillary Clinton and Michael Dukakis. So you have also a very good, I can say good and strong political experience which you can bring into the discussion. And you helped to draft the healthcare legislation for Barack Obama with work on the Affordable Care Act. So a very experienced and strong woman. And when I say that you really play a leading role in the Democratic Party and developing new concepts, new ideas, I think this is not and it's not an underestimation, it's true. So I'm very, very curious to hear your experience, and now you have the floor, Neera. Neera, you have to.
Yes.
Yes.
Thank you so much for those extremely kind words, and I really think this discussion, this panel, is vital. I will say that at the Center for American Progress, as we have tried to understand how to fight the virus most effectively, the examples we have used are global ones, whether it's Germany or Japan or New Zealand. I think the issue with the virus is that obviously it is a global challenge, and it calls for global solutions, in which I will discuss more, but the global learning is so vital to effectively address, contain, and ultimately beat back the virus. So I really want to say thank you. I am thrilled to be part of this critical conversation, and and it's fantastic to share the virtual stage with such a broad team of experts. I will say, in some sense, I feel apologetic because a conversation about respect and dialogue seems a little bit at a low point in the United States. And so I feel like we can learn so much from the rest of the world. But, you know, I will also say that a lot of Americans are ashamed at the response that we've had in the country to the virus, not just how we've handled the virus itself, but our overall approach and how we have essentially tried to go it alone, and how that strategy has contributed to our failures so far with the virus. And so I really appreciate how important collaboration and communication is, not just on the national level, but across borders, and how critical respect and dialogue is in pursuit of real impact on people's lives. And I think what we have learned so far with the virus, with COVID-19, is that countries that do not accept global cooperation, that turn inward, that create essentially norms and a culture of disrespect for the global response, will do much more poorly. The virus has truly underscored how interconnected the world is. The virus knows no borders. COVID-19 knows no borders. It knows no state borders, and it really does not know global borders. And we know that because it has essentially reached most of the globe in months. In some ways, interconnection we've experienced has been really challenging because it has moved so quickly, but it also has revealed how critical international cooperation is. This is not a crisis where one nation can simply purge the virus from its shores and be done with it. it's very much a situation where no one can rest easy. No one, not even countries that have seemingly beat back the virus. No one can rest easy until we have a global response. I've said before that in the US, our healthcare system is only as effective as the care it provides for its most vulnerable people, and our national response is only as effective as the states that take the least government action. So in the United States, where we have states that basically do not practice social distancing, we have seen surges develop that affect the entire country. That is also true at the international level. Radical individualism is not a strategy for tackling this virus, and radical protectionism is not an international strategy either. The only way to really beat back this virus, as I've said, is a global outlook and a global strategy and more global cooperation, not less. When it comes to international supply chains for testing and PPE, and particularly when it comes to manufacturing and distribution for a vaccine, we need countries to work together, not compete against each other, work together. Like climate change and mass migration, the pandemic requires global cooperation. And I have to say, it's odd, speaking of this, from the United States, where we've seen our leadership really work against that global cooperation. Today's international institutions have been hamstrung by nations competing against one another, by leaders choosing to be uncooperative, as our president has been over the last several months. Since we've seen our president, Donald Trump, has not only withdrawn from Paris Climate Agreement or the Iran nuclear deal, but has seized the virus as another opportunity to withdraw and turn away from our allies, which has essentially weakened our response to the virus. That's why institutions like the World Health Organization have been really important. And I am happy to talk more about how we can strengthen regional cooperation as well as international institutions like the WHO. But what we really need to do is ensure that we have a mentality or a philosophy in which, like other global challenges, we see the virus as one where our nations are strengthened by a global response. It is my hope that in the United States, we will return to that perspective in the coming months, and a recognition that our safety as a country is strengthened by a global response that works to eventually eliminate the virus. So if we really want to do everything we can to ensure our own security, we have to strengthen institutions like the World Health Organization, not abandon them. We should strengthen our global platforms, not abandon them. But really, the most important thing, and this has been true in the United States, I serve as an advisor to the Restart Commission in New Jersey, a state in the United States. And our learning, we have learned so much from what is working effectively in other countries. This pandemic it's so vital to have learning shared across the globe. Each of our societies can and must learn about what is most effective with this virus that is new to all of us. And we can actually address, contain, fight the virus without totally shutting down our economy. But in the United States, we only know that from the experience of other countries. And that is why it is so important that we repudiate efforts to stymie knowledge, to repudiate efforts to really handle this virus by ourselves, because the truth is no country will do this effectively on its own. And our only ability to truly fight and beat this virus is if we have a united global response. No economy can truly open up with the virus if the virus is still existent in the corners of the globe. And countries like the United States have to do so much more to ensure a global leadership, which has been, of course, incredibly lacking. So I actually hope that the virus itself is a means by which we strengthen the multilateral approach. I hope that we see in the coming months in the United States an alternate path in which the leaders of the world unite to ensure that we have fought back the virus. It is successful. And we can see that as an example of cooperation that provides tangible results for improving and saving the lives of millions of people. That is a very different future than we seem to have right at this moment, but it is possible. It is possible that with the possibilities of a vaccine, if there is a global effort, we can address this virus like other global pandemic scourges in a way that strengthens our alliances. And I hope builds a path to dealing with pandemics like this and other crises like this in a much more effective way. Because the truth is, in all honesty, we are living with the failure of unilateralism and radical individualism with this virus. The United States right now is the leading example of that, with over 200,000 deaths, my apologies, 200,000 deaths, and going into a third surge, which over the last few days has overtaken the previous two surges. We now have the highest rate of positivity that we've ever had, and the highest number of positive cases that we've ever had. And many states in the United States have the highest rates they've ever had. I think this will demonstrate a level of failure that we can only build from, and only do so from an approach that works with all corners of the global stage. And with that, I am thank you so much for this opportunity. I look forward to questions.
Sorry, now I made the same mistake. Thank you very much, Neera, for your contribution. And thank you very much also for pleading so strongly for cooperation and working together, because our experience shows us that this really helps saving lives, but also saving well-being of people in countries. So that is one crucial, I think, lesson we learned over the last couple of weeks. But now we will move to the next speaker, which is Justin Weiss. I hope I pronounced your name correctly. He is a French historian and is the general of the Paris Peace Forum organization, which is the director general, sorry, the director general of the Paris Peace Forum organization. This is an independent NGO. It was founded in 2018, and you have a lot of experience before you moved to this position, also in other think tanks like Brooklyn Institution, like, for example, in the US, but also other think tanks. You worked as a director of policy planning at the French Ministry of Foreign Affairs. And I think what is very interesting when I look at your work is that you not only deal with what we already know, but also try to look at developments in different countries, in different spheres, and give political advice, how to deal with new developments, how to deal with trends, and therefore try to improve also and promote good policy. And that is as all we know, needed at the moment very urgently. So Justin, we are also very curious to hear from you, and now you have the floor.
Thank you, Edelgard. Thank you, Roberto. It's a pleasure to be with you. Yes, I'm more of a director than a general. I'm not even sure I'm a good director, but a general. I'll leave it at that. I would like to just get back to the position from where I'm speaking. The Paris Peace Forum, as you said, was created 2 years ago under the impetus of President Macron over an analysis of the international system, where we have seen a marked deterioration of coordination, cooperation, in one word, a deterioration of multilateralism over the past 10 years, 15 years, etc. There was never a golden age, but the recent years have really been bad in this respect. However, since the beginning of this year, 2020, and because of the pandemic, it has gone from deteriorating to outright catastrophic, right? What we've seen was basically a breakdown of the normal functioning of institutions that should have reacted better. I mean, we waited for a month before having a true reaction from the G20, the G7, the UN Security Council. Interestingly, local governments, for example, the C40, the Covenant of Mayors, reacted more rapidly than many others did. And so what the Paris Peace Forum can bring to this problem and to the challenge is what we have created over the last 2 years, which is a platform where we gather all the actors of global governance. So our answer to that deterioration of multilateralism is to not only gather states, governments, and we've had over the years, about 100 heads of state attending the Paris Peace Forum, pretty much all of the heads of all the international organizations, but also the other actors, meaning the private sector, foundations, NGOs, local governments, universities, think tanks, and others. And this springs from a very basic analysis, which is that on some issues, only states really matter, like nuclear proliferation. On other issues like the digital world, cybersecurity, for example, or climate, or biodiversity, or health, for that matter, governments are not enough, and you need other actors around the table. Can you imagine the response to the pandemic without the Gates Foundation, without the Wellcome Trust, without Gavi, CEPI, UNITAID, the Global Fund? I mean, it's not unimaginable. And so there's a sort of natural convergence between what the forum set out to do in 2018 and the response that we are giving now, which is a multi-actor response. Moreover, what we set out to do was not to create one more conference. Conferences are fine. We need to talk, especially globally, to try and solve global problems. But talk is not enough. And so we built the forum around initiatives and projects. We do a call for projects every spring from March to June. This year we had 850 applications coming in. We selected 100 of them. And some of them are really spot on for today's debate. For example, we had, so many of them come from NGOs, about half. Many of them come from international organizations, come from companies, come from local governments, etc. One of them came from the WHO, and it's called the Health and Peace Initiative. And what it does, it adds a angle of, let's say, almost, I would say, a geopolitical angle to health programs that go beyond borders. That is, health programs that are regional, whether they're in Asia, in Africa, in Eastern Europe, or elsewhere, and sort of incorporate the political issues into that health program, trying to precisely build dialogue and talks among communities that are often at odds with one another through the health programs. That's just one example of out of 100 of them on the different issues that we're tackling. Then we are also doing another thing, which is to put forward in our sessions the concrete initiatives that are taken, whether it's in cybersecurity, for example. We have a sort of a flagship initiative called the Paris Call for Trust and Security in Cyberspace, which gathers now more than 1,100 actors, 80 governments, 700 companies, etc., around principles for cybersecurity. So it's the largest platform on this issue, and we have been either launching or supporting other initiatives. So let me now say a concrete word on what we're doing at the intersection of, let's say, good global governance, which is supposed to lead to peace and health this year. So this year's forum will unfortunately be entirely online, just like the World Health Summit. We've moved from a hybrid format to a fully digital format a week ago because of the deterioration of the health conditions in Paris and in Europe in general. But it will be a very rich program with about 500 speakers total, with 10,000 people on the platform and with many heads of state. And regarding health, we have 3 or 4 sort of highlights that I'd like to mention, because I think they give an answer, sort of a concrete answer to that dilemma of the lack of coordination among actors, not just states, not just traditional Westphalian actors, we would call them in the jargon, but also the others. So the first one is on the global governance of health itself. We all know what the shortcomings of the WHO are, and the WHO knows them more than anyone else. They have a lot to do with the fact that it's an international organization that is dependent on its member states, and member states tend to control very tightly the information and the decisions that they make within that body. One solution that is put forward is to have, under the One Health concept, to have a council for human and animal health that would be in a position to support WHO on alerting the world on the main dangers of pandemics, especially emanating from wildlife and sort of jumping from wildlife to animal health. That will be done in a pretty Franco-German context on November 12 in the morning with the ministers of foreign affairs of both countries, and will be put forward at that time. In the afternoon, we'll have President Macron, Melinda Gates, Dr. Tedros from WHO and others have a session on Act A, which has been talked a lot about, including yesterday in President Steinmeier's speech. So the Access to COVID-19 Tools Accelerator or Initiative, which works on making these tools, that is to say diagnostics, therapeutics, and vaccines, more importantly, available to all, especially vaccines, of course, because it's much talked about, and COVAX is within that context of Act A. So we'll have a session in trying to sort of relaunch Act A, trying to solve the problems we have, which are problems of financing and perhaps more importantly, problems of, I would say, accountability of the various actors, the states, I mean, the governments, the foundations, big pharma, the laboratories, which tend to expect from governments that they would pay everything, including for other countries and others. So we'll have one panel on this and one panel in relaunching ACTA, and one gathering all the main actors from the Serum Institute of India, Adar Poonawalla, to Thus Berkeley, Marisol Touraine, and many others, Jeremy Farrar from the Wellcome Trust, trying to sort of give a new lease on life or a new impetus to Act A. And then we'll have a couple of other smaller initiatives trying to solve the problems, including on local response to the pandemic, whether on the side of analysis with Imperial College London and Johns Hopkins, trying to figure out what the what the record is and trying to give good facts and numbers, to responders, especially from the development community, from the, for example, the Aga Khan Development Network, which has sort of adapted to the new situation, etc. So the overall objective is really to build a sort of coordinated answer to all of this. Will we succeed on that? I must say that we'll do all we can to sort of help that coordination, but that it doesn't come naturally. What I mean by that is, and I'll finish with that, my 8 minutes are up, is what we've seen so far is a mechanism in which vaccine nationalism in particular has won the day, simply because governments are accountable to their constituencies, and their constituencies are asking for vaccines. And so if they have the power, if it's in their power to secure doses, even at the expense of a better thought out mechanism, then they will do it. And so what we have to do, and what we'll be trying to do, and creating the conditions, gathering the right people to try to counter the tendency, is precisely to try and complement, adapt to that reality. We won't change vaccine nationalism. It's here to stay, but then adapt it so that we can also build a better, let's say, a better scheme of repartition of the tools to fight COVID-19, including vaccines. And we can better make sure that, as Dr. Tedros or President Steinmeier said, instead of having a large part of population in one country vaccinated, we can have all countries vaccinated, even if it's a smaller share of the population. So that's what we'll be trying to do during the Paris Peace Forum, to which I should add you are all invited to attend. Thank you.
Thank you, Shazan, for sharing both your ambitions with the Paris Peace Forum and in particular lifting also the importance of multilateralism, to be able to challenge the big challenges and the existential ones, as for instance the climate change or the infectious diseases. And but also I think extremely important what you're lifting around the importance of having not only governmental organizations being as stakeholders, but the others, and actually having also concrete on grassroots level projects and concrete examples of that you can learn from. Now we will, I have the great pleasure to go to the next speaker. Sorry. Okay. Then I would proceed with the next speaker, and I have the great pleasure to introduce you to Professor Dr. Tolu Oni, and fingers crossed she is connecting from the rural England, but hopefully it will be able to keep on the connection during the whole session. And Tolu is a public health physician scientist and urban epidemiologist at Cambridge University, where she is, as I already said, Senior Research Medical Officer and Joint Lead of the Global Public Health Research Group. And she's also an Honorary Associate Professor in Public Health at the University of Cape Town, where she leads the Research Initiative for Cities, Health and Equity Group. And she serves on several advisory boards, and she's an editorial board member of, among others, Lancet Planetary Health, Cities and Health. And she's a fellow of the African Academy of Sciences and has been a co-chair of the Global Young Academy and was Young Global Leader at last year's World Economic Forum. She's also the founder of Urban Better, science-informed, equity-centered, Africa-led youth privilege movement that supports partnership between science, policy, and societal role players to health-proof the future of cities. And she's a true global citizen. Born in Lagos, completed her medical training at University College London, postgraduate medical training in both UK and Australia, master's degree at the University of Cape Town, and then a research doctorate in clinical epidemiology at Imperial College London. She's passionate, and she's passionate about identifying creative strategies to address complex urban population health challenges in rapidly growing cities around the world to make the healthy choice the easy, sustainable choice. So Tolu, considering that we had a privilege to have you in our panel also last year, where you were sharing your experiences from Cape Town and also your own insights around the importance of capturing various stakeholders' needs and learning how to engage and truly listen to people. Would there be any parallel reflections on the current handling on the pandemic? And then it goes off without saying that we're of course curious to hear about your reflections from what lessons to be learned from the African continent, considering your engagement there in creating better premises for urban health today and tomorrow. Please, the word is yours.
Thanks so much, Roberto, and thank you to both co-chairs. Can you hear me okay? Okay, great. I'm going to try to speak fairly quickly because I don't know how long this is going to last for. So we spoke last year. So my work, I think last year I reflected on some of the urban health work that I do in different cities. Across the African continent, we focus on essentially strategies of creating health outside of healthcare by intervening in those environments that contribute more to influence factors that that either promote or undermine health. I was digging around trying to find some thoughts that I scribbled down from last year. And the two things that I could find, because I just thought it would be good to pivot off those, because I do remember last year reflecting on some of the experiences of trying to bring the healthcare sector and the human settlement sector together, because some of the work a lot of the work that we do focuses on understanding the ways that we can harness the built environment for health, and some of the barriers to that intersectoral collaboration, and some of the experiences that we shared there. I did find two scribbles. I found something that reflecting on why I thought respect and dialogue was an important topic in the health summit. And the two things I thought last year was one, that health is necessarily global. and the second was that this topic forces us to have a discussion on the political, economic, and social determinants of health. And then the other scribble I found was a question around what I thought the underlying philosophy for respect and dialogue would be, and what the objectives of this initiative would be. And the three things I'd said then, I think, were equitable inclusion, accountability, and self-awareness and continuous reflection. So that, as a pivot point to where we are now, is a rather telling tale. I want to focus on just identifying just eight very quick reflections off the top of my head now on where we are and what I think respect and dialogue requires. So interestingly, whilst a lot of my research work is in cities across African countries by virtue of being African of different sorts and living there for a long time, one of the interesting things about this COVID pandemic is finding myself based in the UK, actually lending a lot more of scientific advice into the UK situation, and my parallels with the experience I have in different African countries. And so these reflections come from that both of those perspectives. So the first I thought was that respect and dialogue requires building bridges, right? Building bridges between science and policy. This, I recall, was something that we talked about last year, but also between countries, because we have recognized, and my previous speakers have noted well, that a situation like a pandemic makes us confront the issue that we are unable to deal. No country is able to deal with this on its own. Health is necessarily global. The second point is this: respect and dialogue requires leadership. And the anecdote that I would like to share from this, and I'm sure this is something that attendees, participants will may be familiar with. So there's been work that explore the Global Health Security Index, which existed before the pandemic, obviously, to assess the degree of preparedness of different countries. So if you look at the Global Health Security Index, top of preparedness was the USA. Second in that index was the United Kingdom. And as it's turned out, there's an almost perfect correlation with the Global Health Security Index. Unfortunately, it's an inverse correlation. So the countries in the highest rankings of the index have performed the poorest in terms of death rates, in terms of infection, in terms of transmission, and actually not much association in terms of testing rates either. And one of the reflections, so there's been a number of studies looking at this, and one of the reflections is, well, maybe we should be including some indicators around leadership in the index, which is not something that was previously included, because if you look at the countries that have performed well, a critical ingredient is strong leadership and related to science advice. The third point, which I think my reflection of what also should be included in a Global Health Security Index is that respect and dialogue requires trust, because we have seen again in countries where the trust within society, trust in government plays a really critical role in actually being able to effectively implement public health control measures, even when they are in the short-term period painful, particularly economically, and particularly in the context where you have a lot of mis and disinformation. Really related to trust, we've seen that countries that performed really quite well, like Taiwan, have focused on harnessing existing structures of trust within communities. So I would say in the context of that respect and dialogue and trust is leveraging and understanding the notions of structures that build social cohesion and trust within the community. The fourth is a repetition of what I said last year, but I would reframe equitable inclusion as radical inclusion. Just some reflections from the UK actually, and thinking about the perspectives of science advice and the dialogues that are going on there. And one of the things that was really highlighted is the importance of plurality of perspectives. So that's plurality in terms of disciplines, it's plurality in terms of lived experiences, and plurality in terms of gender and ethnic group measures of diversity. And we see that this is not just something that is nice to have, but that in order to have meaningful and effective dialogue, we actually have to know what we don't know. And the only way of doing that is having this radical inclusion and plurality of perspectives. How am I doing? Still connected? Okay, great. The fifth point is adaptability. And this leads because in the context of a pandemic, we've seen that actually a lot of society is set up based on notions of predictability, right? There's certain aspects of certainty and structure and knowing what comes next that it is required. So then what happens when that's taken away? How adaptable can we be and responsive can we be as the situation is evolving in real time? And that really, I think, uncertainty, in moments of uncertainty, we really need that respect and dialogue, but in order for that to be effective, we need this adaptability. Where we are, 4th, 5th, 6th point is platforms for fostering exchange. So we know that, and we see this, the critical importance of learning from the experience of others. And so, you know, we are, the pandemic didn't hit every country at this exact same time. We have to wonder how better off some of the countries that were hit later would have been if we actually truly learned from the experience of others and integrated that. And so I would argue that respect and dialogue requires support, identifying and supporting the platforms that foster those exchanges and really tapping into those in moments like this. Related, penultimate point related to that previous point is that we have noticed that even when we do seek to learn from experience of others, there are very ingrained biases in terms of our preconceived notions of where expertise lies. So we've seen that in the context of comparing the performance in the UK with, in fact, many countries on the African continent that have done a fair bit better. But there's been innovation around testing and ways to minimize and use resources more effectively. But sometimes what blocks that opportunity to learn from each other is not necessarily the absence of platforms, but preconceived notions of where expertise lies. So really, I think maybe bringing in my point from last year around self-awareness and continuous learning is just really addressing that implicit bias of where we think expertise lies. And my last point is that respect and dialogue requires sustained effort, building on existing assets. It's not a once-off. I can't remember if we spoke last year about the importance of not waiting for moments of crisis to engage with society, because that informs the trust, that informs the leadership, that informs the inclusion, that informs a lot of the things that I mentioned before. So really the importance of the sustained effort in continuing the conversation and this dialogue, even when it doesn't seem necessary, is really critical. And related to that is, from a science perspective, really ensuring that we are building that pipeline. And again, maybe the point that I made last year around earlier platforms that earlier career scientists are convening, like the Global Young Academy and spaces like that, to say within the academic institutional structures, what are we doing to ensure that should we be going through a pandemic like this in another 10 years, that we're not necessarily just relying on the science leaders we have today, but that we would have built the respect and dialogue within countries and between countries to build the skills that were required to ensure that dialogue is sustained and that we have an effective science contributions to addressing complex societal issues that will undoubtedly continue to confront us in the years to come. So those are my reflections. Thank you.
Thank you very much, Tola, and wonderful that you stayed connected and passionate as always. And all the points I think are extremely relevant for the respect and dialogue discussion generally, but of course also in the application of the ongoing pandemic. And in particular, I find it, it might sound simple, but say, what you don't know, but that is really the point here. Actually, if we have a biased idea where we take the expertise, and so the importance of the plurality of perspectives and creating platforms where there is exchange, I think there is crucial in what you're, so thank you for sharing this. Now, in respect of time, I will pass over directly to introduce you to Dr. Monef Arsoubi, who is Science Advisor for Interaction Council. And 2 words just about the Interaction Council, which is an international organization of former heads of state from all over the world, and it was established in 1983 as an independent international organization to mobilize the experience, energy, and international context of a group of statesmen and stateswomen, I will hope, have held the highest office in their own countries. And they develop recommendations and practical solutions for the political, economic, and social problems confronting humanity. And serving in their individual capacities, the Council aims at fostering international cooperation and action in 3 priority areas, which I don't enter, where maybe Monef you will refer to, and has during the ongoing pandemic urged for urgent global cooperation to combat COVID-19 and plan for a better future. Previously, Dr. Arsoubi worked for the Islamic World Academy of Sciences, firmly positioning the organization on the international scientific and technological collaboration landscape, for which he served as Director General for more than 20 years. And he's yet another global citizen, born in Amman, received his undergraduate and postgrad degrees in in UK, and then pursued further postgraduate work at the Department of Science and Technology, studies at University of Malaya in Malaysia. And over the last 3 decades, Dr. Sube has devoted all his energies to humanitarian causes, to sustainable development, to science and innovation advocacy at all levels, and to bridging scientific and technological development between countries, cultures, and civilizations. In 2010, he co-authored the UNESCO Science Report, which foresaw the advent of the Arab Spring. And he's a member of many international organizations, including World Academy of Art and Science. So Monef, considering your engagement in various contexts for a more sustainable world and an aware use of science technology in favor of progress, we are of course curious to hear your reflections on the questions we have raised. And I'm sure you will also approach the question regarding the role that multilateralism and multi-perspectivity play. Please, Monef.
Thank you very much. I have to acknowledge first, of course, some eminent friends, Professor Gunton, Professor Ibingira, Dr. Kickbush, and you, Chair, Chairs Bullman and Chair Monti. And must say that I'm honored to be in such distinguished company today to talk about science and bridging divides, the respect and dialogue nexus, or the R&D nexus. Coming into this seminar today, I listened to Jeffrey Sachs talking about multilateralism. And I must admit that I have found what Jeffrey said today, apparently at a meeting at the Vatican, very similar to what Nira said at the start of this meeting, in terms of who's responsible for the world multilateralism and who's responsible or follows the school of thought that calls for unilateralism. Having said that, I will tell you that on the eve of the COVID-19 outbreak, a global rivalry has been fermenting between our world's unilateral camp, exhibited by American primacy, and the multilateral camp, represented by the BRICS, with tacit countries with tacit backing from many countries in Europe, South Asia, and Latin America. Looking back, only an occurrence as momentous as 9/11, although momentarily, brought peoples together in the face of the global terrorism pandemic back then, that event represented. I must emphasize here also that the notion of respect and dialogue, what I have today decided to call R&D, are essentially multilateralist or multi-stakeholder phenomena practiced in groups. We talk of respecting the other and interacting with the other. Although crises tend to steer behaviors towards limited openness, as one of the previous speakers mentioned, perhaps as demonstrated in those dark days of 9/11. The COVID-19 pandemic has proven to all that we human beings are one. Human beings may have different dreams. However, we all go to bed under the same sky every night. And we are all set to face numerous challenges in our post-COVID-19 world. At present, the UN Secretary General is not a happy man, because the collective and positive Kai that prevailed globally when the 2030 Agenda for Sustainable Development was adopted in 2015 is today no longer. Mr. Guterres' call in March 2020 for an immediate ceasefire in all world conflict zones and for opening up the windows of diplomacy and dialogue in order to bring hope to the most vulnerable human beings facing COVID-19 went unheeded. A call that was endorsed by the Interaction Council, as well as many members of the Interaction Council, as well as members of the Nizami Ganjawi International Center, which is a forum of concerned leaders. Perhaps in the hope that the UN would again assume its collective responsibility as the guardian of international peace and security while the world fights the deadly COVID-19 pandemic, Guterres advocated that the world must turn to science and solidarity, not least to combat the spreading of the global pseudoscience or misinfodemic, because undeniably the current pandemic underlines the importance of accurate scientific knowledge provided by respected national advisory mechanisms to guide political decisions. We have witnessed how political leaders in Italy, Brazil, Spain, the UK, and the US only paid lip service to science-based advice and pushed their countries to the brink of catastrophe. In all 5 cases, after initially disregarding the assertions and data provided by the science advisors, they, the leaders, rather belatedly changed course. The UN Secretary General must likewise be disappointed with the failure of regional groupings to respond to the current crisis. For instance, when the epidemic struck Italy, Spain, and other European countries, none of the said countries received the expected aid from their European partners. We can take some comfort nonetheless from the fact that humans have more often than not banded together in the face of all kinds of threats. Examples exist of countries sharing and providing medical equipment, test kits, and other essential medical supplies. The example of the Chinese businessman, Mr. Jack Ma, donating 100,000 COVID-19 test kits to Jordan in March 2020 is an encouraging example of this. The fight against the devastating COVID-19 inevitably highlights that science has an institutional role to play in addressing this dilemma. Thus, as well as the various United Nations organizations, the Interaction Council, and other organizations, academies of sciences can play a real role in providing expertise and advice to decision makers at the national and international levels. An interesting example here is the commendable role played by the IAP, the InterAcademy Partnership, which is a global network of national science academies that has issued important recommendations on addressing the corona pandemic this year. And for the work of the Interaction Council, allow me to refer you to the presentation of my colleague at the Council, Dr. Joanna Nurse, who spoke first thing this morning. Her presentation, I think at some point, will be online. In all its ramifications, COVID-19 threatens to push our human, social, political, and economic systems to the brink. Disease, recession leading to mass unemployment, and uncertainty can overpower individuals, societies, and states. The immediate future will bring increasing challenges that can only be met by caring for the sick, minimizing the impact of lockdowns on the lives of human beings, securing the delivery of adequate water, food, and energy supplies. And on the research front, scrambling for a vaccine and a cure. To manage the socio-political and socio-economic fallout on our post-COVID world, polity, government, should focus on respect and dialogue as a foundation of national and international security. Our post-COVID-19 world will witness extraordinary problems with polities struggling to maintain social order, upholding security, whilst generally adopting good governance practices. Realizing long-term security in most countries can only be achieved by assuring sustainable and equitable socioeconomic development. Regional insecurity is heightened in the absence of dialogue that has to again become the norm in the face of existential threats, both regionally and globally. My last two very brief comments, chairs, is that the 2030 agenda still represents a political manifesto for the post-COVID-19 world over the next decade. Based on the principle of universality, it nevertheless allows every country to contribute to achieving the larger vision of global sustainable development without dispensing with the ownership of its national development agenda. It aims to transform our world by addressing the interconnected root causes of poverty, hunger, pandemics, environmental degradation, climate change, and migration, and propagates a global partnership that will work in a spirit of solidarity with the poorest in particular and with people in vulnerable situations. The spirit of the 2030 Agenda for Sustainable Development has to prevail again. Revisiting the agenda is necessary to factor in new health and globalization parameters, as well as elements that have come to undermine the foundations of contemporary society, with its rampant inequality and rising injustice, and which threatens the very survival of our species. The revised agenda has moreover to extend the ethic of human solidarity beyond the contours of our immediate response to the outbreak of COVID-19. Now, humanity's real triumph lies in the taming of the coronavirus or in rediscovering the principles of R&D, that is, research and development for a sustainable future, and the importance of another R&D, respect and dialogue for justice, solidarity, and partnership, as partly outlined in the Interaction Council's own Universal Declaration of Human Responsibility. Our world must institutionalize these values in the days, weeks, and months ahead. Thank you very much.
Thank you very much. Thank you very much, Mr. Subu. As we are running out of time a little bit. That's why I want to make the introduction of Clara Maria Cruz very short. I hope you forgive me, but I just want to say that Clara Cruz Santos is a professor of social work in Cambridge University. She is widely published, including as an author of or co-author of 6 books relating to social inequality and other social issues. And one book I would like to mention, especially Reframing the European Social Welfare State, because I think that is one of the challenges we are confronted with in many countries of reframing what social welfare state really means nowadays and today. And therefore, Clara, again, we are very curious to hear what you are going to tell us, and you have the floor.
Hello, thank you very much. I don't know if you can hear me well. Yes, okay. So thank you very much for the invitation, and it's a great honor to be here and to learn so much with you all. So I'm going to make the presentation by PowerPoint because it helps me to regulate myself in terms of time, and so we are running out, so it will be easier. So I also want to apologize because my accent in English, because I have a strange accent in Portuguese also, so that will be even difficult in English. So I'm going to do my best, and I will try now to, okay, it's, can you see properly? I can see your faces, so I don't know if it's everything okay. Just please let me know something.
You're doing great. English
okay.
Included.
Okay.
But we don't see any presentation, so you will probably have to share the screen.
Oh, okay. Sorry. Just running. Okay. Now I think it's. Now it's okay?
Yep.
Okay, thank you very much. So I'm a professor and a researcher, and as I'm working in the field with some NGOs, I think that my input could be interesting in terms of what this is. Refugee. It's a refugee boy with a beautiful face. So I think that I try to organize my presentation in around two possible forms. One is to characterize the problem as a systematic and a complex problem. That's to say that there are two main elements. One are the producers and one are the producers, but also they are very interdependent with each other. And another point that I would like to present and to discuss with you is the possible solutions, possible ways of turning out and to cut off, to cope with the cycle of precarious, disanimous, and precarious. So one of the when we speak about I'm just trying to put your faces here. When we're trying to see the side effects of the pandemic, because I think when we speak about dialogue, we and the peace dialogue, we need to taking into account the side effects of the pandemic COVID-19, more than discuss the health, but to discuss the social impacts of the pandemic around the world, around communities, and of course within the refugee communities. And also all society now are able to lead with this another problem that in the context of COVID-19 may be as a threat. So one of the elements that are part of this systemic approach of the problems can be I divided by the problem that we people see that we are living in social risk or in danger societies. Another one is that to see this is to see that conflicts are rising up, and also with the conflicts and the social risk, increase of precariousness and vulnerability among the communities. And that leads for another issue, and another important issue is the deservingness of protection and support that all these combined elements can contribute. So when we are talking about social risks and risk societies, we are speaking of some concepts that are also defined by Beck and Giddens, that determines the post-industrialization societies, and now make much more sense in the pandemic COVID societies and pandemic COVID after, and the societies after COVID pandemic. And the social risks and risk society, it's a kind of a way of see that we are living in a world that is a social, economic, and health context that presents a complex and unpredictable nature, which global states have difficulty in regulating. The new risks associated with the side effects of COVID-19 are difficult to anticipate, to prevent, and to resolve, and therefore demand new forms of combat inequalities and despair. The new forms demand flexibility from global policies and from global strategies and social practices, but mostly they demand very solutions and very concrete programs that must be implemented. So demands urgency also and reinforcement of formal and informal support networks for the dialogue and peace-based and cultural pluralism. Sorry, I think that you are understanding me because of these difficulties. So the problem traced is that to how we can see this. Um, and another important dimension for peace dialogue is that COVID-19 has amplified conflict. The deep stress experienced by population makes them more fragile and as such less tolerant to unfamiliar situations and citizens who may be considered as a threat. In this case, we include communities' relationship with migrants, refugees, and increasing sympathy for fake news based, populist, and radical discourse, which, due to their rigid thinking and by spreading false expectations, are likely to be recognized as a feasible solutions to the population's despair. Based on available data, it appears that pandemic COVID is the worst to reveals on the path to reduction global poverty and social inequalities. And now we are referring to social development goals 1 and 10. The idea this population deserves or not social protection measure is an important issue because it reflects the collective social solidarity with migrants population. The deservingness, the deservingness, I'm not saying this word very correct because it's difficult for Portuguese language to say it, but I think you are understanding me, is debate in silence among important social actors and discussed openly and in a least informed possible way by populist movements that use it as an asset to compensate and recover the side effects of the pandemic 19. The point here is to understand how the discourse on deserve or not influence not only public opinion, but also practical interventions and programs at the national and local level, especially the ones that emerge from a capitalist or from a very extreme right wing that identify the deservingness with the activity and the potentially productive refugee and migrant. If they are not contribute to the system, why we must support them? If they we and this is a very discourse that is very dangerous, that is very and it appears to be some new forms of a new discourse that somehow as being considered as sympathetic, as making sense for some populations, and we must cut this time of discourse. Otherwise, the world can be much more risky than the one that we live today. So possible solutions and possible trajectories relates what we call the time, the urgency, the bureaucracy, and the local action. The time variable within the pandemic context and in the reinforcement of dialogue and cultural peace is central in the view of the successive outbreaks and increase of precariousness in Europe and the world. So the faster social cohesion measures, the faster the equilibrium will be restored. Time is something that we cannot lose. We have to run. The things are happening now. We have to act now. So The time variable is closely linked to the implementation of containing and support measures to nurture social solidarity in affected countries and communities to ensure that governments' decisions can be trusted. The paradigmatic difference between law in book and law in action is more intensive than ever. The quotation that social change is not made by decree laws suggests that strengthening policy measures and social practices at the local level in municipalities is fundamental. So think global, act local, and the important to have more than ever practical measures and to need to be monitored by a more state in local and municipalities. So in Portugal and similar to other European countries, the work of local associations, NGOs and other institutions supported by High Commission for Migrants have contributed in relevant way to social integration and assistance to refugees during the pandemic situation. However, fragilities remain, which could be overcome and within our point of view and our research for the points that we highlight here. So the first point is the consolidation of the formal supporting networks. And the consolidation of the formal supporting networks must be done with decentralization, with more local forms of support, with more local evidence-based to not only monitorize, but also to give an holistic response to an holistic problem. Somehow that we feel that the service belong to immigrants and the different services are somehow fragmented service. So the citizenships are always moving around service to service, not having a holistic response. And this must be overcome in the next weeks, the next month, very urgently. Yes.
Yes. Thank you very much, Clara. Thank you very much.
I'm running time.
We are running out of time, and not only you, the others as well. We are running out of time. So
I haven't finished, but I can finish now if you want me to finish.
Perfect. I thank you. Thank you very much. You gave us such a lot of really important advice. So is it possible, I ask, is it possible to add 2 minutes?
Yes, I can show. Yes, I can show the video. Yes.
You, but I would love to give Detlef the floor, Detlef Ganten, because he's online.
Oh, okay.
So he can ask his question, and then I would just wrap it up very short, and make a proposal. Detlef, are you still online? If that's not the case, then I just say thank you very much to all of you. I would very much love to deepen this discussion, and I will go discuss this point with the organizers of the conference, because I think we should follow up what you put into this discussion, because respect and dialogue as a very important aspect of good governance is so important. Also very important aspect for overcoming the pandemic and fight the pandemic very successfully. We should continue this and not wait up to the next year. Let me just stress two or three aspects. One of you, not only one, but many of you mentioned the relation between, on one hand, trust and and on the other hand, respect and the willingness to dialogue. And I was always thinking when you said that, what is trust the precondition for respect and dialogue, or is respect and dialogue the precondition for trust? Between trust is so crucial for everything. My own experience is respect and dialogue is a precondition for building trust. But I would like to follow this discussion, because both are, I can say, two sides of a coin. So they belong together. And if we want to, for example, strengthen our global platforms, our global organizations, strengthen multilateralism, we have to discuss this question. How can we do that? Not only by making good proposals, we know that, but by also at the same time building trust. And how to do that? That is one of the major questions. So I would love to follow up this point and this aspect. The other point I would love to follow up is how can we make the aspect and the point you mentioned, all of you mentioned, learning lessons from each other. How can we make this more successful and more effective than we did over the last couple of years? We were successful, I think, in some areas, in the health sector areas, fighting and in the research area, for example, in developing effective methods, how to prevent infections. So there is some success on one hand, but on the other hand, we were not very successful. So again, what could we do better to strengthen multilateral global organizations? Because we need them very strong, as strong organizations. And the last point I would like also to mention again, and I would love to follow up, is this. Tolu said, for example, health is necessarily global. Yes. But again, what is true for climate change, I think, is also true for health. That is at the same time local. And to strengthen the interdependence between local level and global level is, I would say, a precondition for example, setting up effective global organizations. If we don't succeed in setting up and building stronger networks between these two levels, then we won't succeed in strengthening our global institutions and organizations. So if you would agree, and I hope you do, I would love and think of a way to continue this discussion we started now, because I think it's worthwhile. And the Health World Summit, as you know, is not only a conference in a year, but is a network we set up. And therefore, I would love and encourage you to participate in this network. And if you are willing to do that, we will address you. If you are willing to do that, we are very pleased, and hope you will do that. And Roberto and me will address you, as I said, and try to set up a small network in this area, respect and dialogue. So thank you again. Thank you very much. And a lot of success for your work you're doing. It's so crucial. It's so important. So don't hesitate to support each other. And now, good luck and good evening. And thanks again for your contribution. Thanks a lot. Bye-bye.
Thank you, Delgara. Thank you.